Well, I mean, the two large institutions, but you also, the VA is an excellent facility. We've got a long-term care, we're gonna have a psych hospital, so I think we need to bring all the parties together to start with. And I'm a firm believer that the community needs to be involved. Boone is the third or fourth largest employer in Boone County, so we need to reach out to the community. The community business needs to be behind this. The school systems, we've got an excellent school system, we need to promote that. So there's a lot of things we can do. The airport is a big issue to get, if we want to bring patients in from out of state. So there's a lot, but no one entity can do that by ourselves. We've got to do it as a community.
I had a conversation earlier this week with a physician who feels that the messaging that's going around that is sort of hokey. Medical tourism. When you're looking for health care, you're not a tourist. You're someone serious in need of serious health care. And this physician felt like in specific service lines for specific areas, hearts, oncology, orthopedics, we're already a destination medical center. People already come to Columbia for those things. As long as we don't have collaboration though, we will never be at the level of a Mayo Clinic or a Cleveland Clinic or UNC or name any prominent health system across the country. That's where fundamentally we have to figure out a way that we can collaborate with the crosstown rival and with the VA, like Randy pointed out, and really make strong use of the brilliant physicians that we have here without undercutting each other.
I've been told by some people that Boone Hospital can't go alone, that we need to be part of a bigger conglomerate. And this is probably the same line that Anheuser-Busch gave to Flat Branch Brewery, Broadway Brewery, and Logbrook Brewery. I think medical industry is changing, and there are vast possibilities. As you know, Congress is looking into a lot of different things. And finally, furthermore, having an outside entity run our local hospital is like having Mizzou basketball team run by KU.
We talked about all the entities that are involved here. There's other players out there. There are several very large and efficient and strong doctors groups.
What are they?
Doctors groups. I mean, they need to be part of this discussion as well. They've got a big voice and they carry a pretty big stick. So I mean, it's very difficult. There's the opportunity here, if we're patient enough and smart enough and ambitious enough to bring together some of these entities. Discussions have started. I think it's going to be better when the timetable is a little bit harder to kind of quantify.
Let me take this one step further, because it's an area we haven't talked about so far, and that is telemedicine. Telemedicine is using electronics to bring patients and physicians and caregivers out in the community in a rural setting into direct contact with physicians here in Columbia, whether it's at Boone Hospital or MU. As it works out, probably MU is actually the center of telemedicine worldwide in many respects. Karen Edison has taken the leadership on this for many years and is recognized as being the leader of this. There's nothing really stopping us from using the expertise and her contacts to develop telemedicine as the glue that helps healthcare in general throughout Missouri and also helps to build healthcare here in Columbia.